Yeah, my name is Dr. PJ Madam Rafi. Today we are going to discuss about neurodegenerative diseases. So, what are the types in neurodegenerative diseases? We'll have Parkinson disease, Alzheimer's disease, Huntington chorea, amyotrophic lateral sclerosis, and multiple sclerosis. Different diseases will have different pathophysiology. We will see each one. First, Parkinson disease, there will be main pathophysiology will be decreasing of neurotransmitter dopamine and increasing of acetylcholine. There will be alteration in dopamine acetylcholine balance. Okay. So in Alzheimer's, the main neurotransmitter will be involved here is acetylcholine, that is decreasing of acetylcholine. In Huntington chorea, it is a genetical disorder. Here main gene involved is Huntington gene and dopaminergic overactivity. So in amyotrophic lateral sclerosis and multiple sclerosis, these are neuronal involved diseases. So will be mainly neuronal demyelination of neurons will be involved. So, what is the main pathophysiology and etiology for neurodegenerative disease will be? They will be inducing oxidative stress and excitotoxicity and deposition of pathological proteins and apoptosis of neuron cells. Okay, these are the main etiology for the pathophysiology. Okay, so here you have to remember, they will ask whether maybe the which disease will have which neurotransmitter alterations. In Alzheimer's, acetylcholine. In Parkinson, mainly decreasing of dopamine. In Huntington chorea, it is a genetical disorder and dopaminergic overactivity. Okay, based on this one, we will treat the diseases. So we will see each disease in following slides. So what is first? We will see Alzheimer's disease. Alzheimer's is a age-related dementia, that is senile dementia. Here main pathophysiology will be deposition of amyloid plaque, that is a protein deposit in the hippocampus, and loss of cholinergic neurons. That will be there will be decreasing of acetylcholine in the neurons. Okay. So the main treatment will be here we'll use anticholinesterase enzyme inhibitors like tacrine, donepezil, rivastigmine, galantamine and N-acetyl-L-carnitine, memantine, vitamins and pepinizumab. Okay. Here main you have to focus. Tacrine is a hepatotoxic, so we'll go with donepezil, rivastigmine and galantamine drugs. Okay. And recently developed drug is N-acetyl-L-carnitine. It is a structural analog of acetylcholine. So we can use mostly now we are using N-acetyl-carnitine. It will decrease the progression of disease. Okay. And increase cholinergic transmission and will decrease the progression. Okay, that's why we are most preferred here is N-acetyl-L-carnitine. Next is memantine, is acetylcholine mimetic drug only. Next vitamins will be antioxidants like A, C, E and some elements like zinc, selenium, bioflavonoids also we will use to decreasing the neuronal degeneration. And monoclonal antibody, it is in a development stage, that is pepinizumab. Okay. Next disease we'll discuss here Huntington chorea, because we are not discussing Parkinsonism in this class because we already discussed in previous class. That's why we are not discussing here. Okay. Next, Huntington chorea. It is already explained you. It is an autosomal dominant disease. Main phase it will be choreic hyperkinesia. That means it is a patient will have dance-like movements of limbs and rhythmic movement of tongue and face. Okay. Based on this limb movement, face and limbs will be face and tongue will be moved along with that movement. Okay. Second one will be main etiology will be already it's a Huntington gene will be defective that regulates various proteins, excitotoxicity and apoptosis of neurons. Okay, based on that one, patient will have degeneration of neurons. Second one will be loss of GABAergic neurons. Okay, GABAergic neurons will be GABA is a inhibitory. Loss of GABA means there will be overactivity of this one will be there. Next, dopaminergic overactivity. Okay, so to overcome this one, obviously we will use dopaminergic inhibitors like chlorpromazine, haloperidol, olanzapine. These are block D2. D2 mainly in the brain receptors. Okay, that's why we'll block D2 selective D2 blockers only. Next drug will be tetrabenzene. Tetrabenzene is the drug of choice. Now it is a dopamine depleter. So for MCQ, they will ask like Huntington chorea drug of choice means we will have to go with tetrabenzene. Okay. Next drug will be deutetrabenzene. It is an analog of tetrabenzene. And one more drug is there, that is reserpine. These will decrease dopaminergic activity and enhance GABAergic neurons activity. Main pathology will be due to Huntington gene. Okay. Main pathology will be due to Huntington gene only. What are the drugs will have? Dopaminergic blockers like chlorpromazine, haloperidol, olanzapine and tetrabenzene. Next disease will be amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis is a degeneration of neurons mainly in the spinal cord and cortex. Main features will be spasticity of muscles will be there. So here they will ask the drug of choice only. That will be riluzole. It is a NMDA antagonist. Next will be edaravone. It is a free radical scavenger. There will be decreasing antioxidation. Okay. Next, multiple sclerosis. Multiple sclerosis is an autoimmune disease. It will cause by demyelination of mainly neurons. So here firstly we will treat with corticosteroids in acute phase only. Then we will go with interferons, mainly glatiramir and fingolimod, and monoclonal antibodies like alemtuzumab and acrelizumab. Okay, these are the drugs mainly used for multiple sclerosis. Because of this autoimmune, we will use steroids and interferons to control the immunity. Okay, autoimmunity. Next, in this slide only in this class we'll discuss Wilson disease also. Wilson disease is mainly due to hepatolenticular degeneration due to excessive accumulation of copper. Mainly due to accumulation of copper in the hepatolenticular, it will cause degeneration of hepatic cells. Okay, so what is the main treatment will be? Previously we were using D-penicillamine. It is a copper chelating agent. Because of its major adverse effect like lupus like syndrome, optic neuritis, bloody dyscharias, we are not using this one now. So we are using most preferably drug will be trientine. That is, it is also copper chelating, but the adverse effect will be, it has more safety profile compared to the D-penicillamine. D-penicillamine will have more adverse effects like lupus, optic neuritis, all these complications will happen. So we will go with trientine. Along with this, we will have used some elements like zinc and potassium. They will decrease the intestinal absorption of copper. So when you are decreasing the intestinal absorption, obviously there will be decrease in accumulation of copper in the liver. So there will be no when there will be decreasing copper in the liver, obviously the disease pathology will be controlled. Okay, thank you.